A 45-year-old patient with a history of hypertension and type 2 diabetes presents with complaints of worsening edema and shortness of breath. His current medications include metformin, lisinopril, and hydrochlorothiazide. Laboratory tests reveal elevated serum creatinine levels. Which of the following pharmacological interventions is most appropriate for managing this patient's condition? And the options are: A. Discontinue metformin and initiate insulin therapy. B. Increase the dose of hydrochlorothiazide. C. Add a loop diuretic like furosemide. D. Switch from lisinopril to losartan. 5, 4, 3, 2, 1. The right option is C, that is add a loop diuretic like furosemide. Explanation: the patient presents with worsening edema and elevated serum creatinine, indicating possible fluid retention and compromised kidney function. Adding a loop diuretic like furosemide is a common approach to managing fluid retention in patients with compromised renal function. It can help alleviate edema and reduce the workload on the kidneys. However, the final decision should be made in consultation with a healthcare provider, considering the patient's complete medical history and clinical condition. Discontinuing metformin and initiating insulin therapy, option A, might be considered if there were significant renal impairment, but it's not the primary intervention for fluid retention. Increasing the dose of hydrochlorothiazide, option B, could worsen the situation by further reducing renal function. Switching from lisinopril to losartan, option D, is a reasonable consideration, but adding a diuretic is more appropriate in the context of worsening edema. Adding a diuretic is often a more appropriate initial step to provide rapid relief and address the immediate symptoms associated with fluid retention.